Acupuncture, the theories of that inform acupuncture are the theory of holism, the theory of yin-yang, the theory of qi, the theory of meridians, and the theory of acupuncture points. And some you're aware of, and some I think will be new to you. So let's first talk about the theory of holism. The theory of holism states that humans are part of the environment and cannot be separated from it. The human body is to be viewed as a whole, and that all organ systems are connected to one another. A change in one part of the body affects the whole body, and the human body adapts to the environment. But when the body fails to adapt to the environment, disease ensues. The theory of yin-yang, and the symbol that is, I'm sure, very familiar to all of you, is the yin-yang symbol, or the Tai Chi. This is the basis of all traditional Chinese medicine philosophies. It was elaborated actually through Taoism during the yin-yang school, and it talked about living in harmony with natural law. And during this period, Taoists observed natural phenomena and how they are reflected in health and disease. And they did this. Taoist adepts or Taoist monks lived in holy mountains, and they meditated all day long, and they meditated on nature, and they understood the properties of nature in a deep elemental way. The fundamental concept of yin-yang theory is balance, that complementary opposites attract. So yin is dark, inactive, quiet, winter, female and inward, and yang is light, active, loud, hot, male, and outward. So the goal in traditional Chinese medicine is to rebalance yin and yang. And health is a balance. When there is a balance between yin and yang, then health ensues. Qi is the vital energy that courses through our bodies. I like to think of it as the difference between a corpse that is dead and an alive person. All the organs are there in a dead person, but the elemental life force is not present. The qi is not present. Qi flows within and around the body. Qi unites heaven and earth and human in between. And qi is in a constant state of transformation and flux. The meridians which the qi flows through in the body are compared to rivers in the body, because traditional Chinese medicine developed in agrarian China. Qi flows through the body through channels called meridians. Qi flows through and regulates the body's physical, mental, emotional, and spiritual states. When the body fails to adjust to changes, qi is disrupted, and disorder and disease ensues. The acupuncture points, well, there are basically 361 standard acupuncture points and many extra points. The flow of qi is regulated through inserting acupuncture needles into acupuncture points that lie on the meridians. Thus, the Chinese practitioner, the Chinese physician, can regulate yin and yang, and therefore rebalance the qi of the body and rebalance the body so conditions and diseases reverse themselves. So now I'd like to tell you a bit about my program of research. I'd like to tell you a bit about my first study that got me interested in doing acupuncture research, which is acupuncture for the treatment of vulvodynia, a randomized waitlist controlled pilot study. The definition of vulvodynia is vulvar pain of at least 3 months duration without clear identifiable cause, which may have potential associated factors. The vulva is the outside genitalia of a woman. So why did I do acupuncture for vulvodynia? Ask the dog who's getting treated for a headache with acupuncture. Well, it's because I'm a certified nurse midwife and a licensed acupuncturist. And I saw many, many women with this condition. They complained of vulvar burning and painful intercourse. and they'd come to see the physicians, and they were given a myriad of prescriptions for vaginal infections that they did not have. So we had nothing in our paradigm of Western medicine to effectively treat these women. And thus I decided I then put on my acupuncturist hat and developed an acupuncture protocol, which I tested. And because these women also come for multiple gynecologic visits, as I had mentioned, with vulvar burning and itching and pain, and dyspareunia, which means painful intercourse. They have painful speculum insertions during exams, and they're prescribed multiple prescriptions, as I mentioned, and they get no relief. So no therapies have been proven efficacious. Rapid pain relief is unpredictable and rarely attainable. The remission rate is only about 25%. And desperate women often turn to acupuncture. Also, there was a large meta-analysis, which means an analysis of many, many studies on acupuncture that showed a significant difference between acupuncture and fake acupuncture for the reduction of chronic pain. So I packed myself up and I went to China, and I attended Guangzhou University of Chinese Medicine. And there I am as a student there. And Guangzhou is in Southeast China in Guangdong province, very near Hong Kong. And I attended school there for 4 years. Here I am. You'll see my name outlined in red, the only English script on the page, where I'm defending my dissertation in 2013, Acupuncture for the Treatment of Vulvodynia, a randomized waitlist controlled pilot study, which I then published in the Journal of Sexual Medicine. The acupuncture point protocol, just to show you how I develop these things, are right here. And this is what we use. We use a standardized protocol because this is for research. When acupuncturists contact me about needling their patients for vulvodynia, I give them this protocol, but I also tell them to personalize it, because that's one of the beauties and one of the strengths of Chinese medicine is that the prescriptions are tailor-made for each patient, but for research, we must standardize. We found that there was a reduction in vulvar pain, a reduction in painful intercourse, and an increase in overall sexual function in women who were treated for acupuncture versus a waitlist control group, which means women just went about their lives and they were control groups to compare the acupuncture group against. Well, this, though, was an unblinded sample. What does unblinded sample mean? It means everyone, including the investigators and the patient, knows who's getting acupuncture and who's getting no treatment, which creates what we call bias and leads to untrue effect. The data, it was not collected on the long-term benefits of the acupuncture protocol, and we were not able to use a double-blind study design. And the double-blind means that acupuncturists and participants are blinded to the intervention, as I had mentioned. The issue is it's very difficult, unlike in Western medicine, if an investigator is studying hypertension, we can always use a sugar pill that looks just like the real pill, or something we call a placebo pill. And we can compare the real medicine to the sugar pill. Well, it's very difficult to do when a participant sees, or the acupuncturist sees, what kind of needle the patient is getting, or whether or not they're even getting a needle. So I went to Japan and studied with my colleague, Nobuari Takakura, who is the inventor of the double-blind acupuncture needle. And I used these double-blind acupuncture needles in a study that I'm just completing that was funded by the National Institute of Health, the National Institute of Child Health and Human Development. Vulvodynia, a pilot study. Well, that was my pilot study, pardon me. The pilot study first, before I went to do the NIH study, was actually just looking to see whether or not these double-blind needles would work. And here we go. Here is a blunt tip needle that does not penetrate the skin, and a penetrating needle that indeed does. And this is part of where the needles are placed for the vulvodynia protocol. That led to my NIH study, which I'm just completing, which is where I use double-blind needles to use the same acupuncture protocols in women who received the treatment versus the placebo needle. So that actually, we're just analyzing the data, and it should be out very shortly. I then also was approached by a colleague to look at the use of acupuncture to improve symptoms of stable angina. Stable angina is a condition where people, men and women, have chest pain that is either with exertion or with emotional stress. And angina leads to heart attack and other problems with the cardiovascular system. The issue with, so I was funded to do a study, what we call a feasibility study, to see if whether or not it would work, and to look at beginning what's called efficacy, or would there be a difference between the acupuncture and the control group. And I was funded by the National Institute of Nursing Research for this study. The background of stable angina is that 9 million Americans have it, and the incidence is not decreased, but actually increased. And as I had mentioned, it leads to heart failure, atrial fibrillation, myocardial infarction or heart attack, and cardiac arrest. And despite treatment, up to 30% of patients with stable angina have symptoms, even though they're taking all their medications. So that led us to, we actually showed that there was a reduction in angina pain and an increase in quality of life, and it was feasible or possible to do the study. So then we were just awarded, actually this past September, for a 5-year study to look at the what we call efficacy of acupuncture, to continue our work for acupuncture for treatments of stable angina. And Dr. Devon and I were funded again through the National Institute of Nursing Research. Now I'd like to tell you a bit about a study that actually I am one of the principal investigators in, and Dr. Lee, who will be speaking in a moment, is a co-investigator on our study. Actually, this first study is a feasibility study. Again, the question is, can we do the study? Can we pull it off? And I'd like to tell you a bit about sickle cell pain now. Individuals with sickle cell disease have high levels of pain. Pain is the leading cause of emergency department visits and hospital admissions. The treatment is focused on medication therapy, specifically on using opioids to reduce the severe debilitating pain of sickle cell disease. And few complementary and integrative therapies have been tested. So we actually, Dr. Lee and I, did a feasibility and what's called acceptability study of performing acupuncture for the treatment of chronic pain in adults with sickle cell disease. We found that indeed it was feasible, and the patients accepted the acupuncture for treating their chronic pain. This led us to a large 4-site study called Hybrid Effectiveness Implementation Trial of Guided Relaxation and Acupuncture for Chronic Sickle Cell Disease Pain, or as we know it, the GRACE trial. And Dr. Bashir and another one of our colleagues, Dr. Martina Moore, are acupuncturists in this study. And without them, we could not do it. We are indebted to them. This study was funded by the National Center for Complementary and Integrative Health, one of the 37 institutes of the NIH, and we will be recruiting through March of 2025. And this study is also part of what's called the HEAL initiative, which you may have heard of. This is the NIH initiative, which has funded over $36 million worth of studies. The HEAL initiative stands for Helping to End Addiction Long Term. So the HEAL initiative actually focuses on people who have substance use disorder, and it also focuses on people who have chronic pain that is so debilitating that they must take opioids in order to reduce their pain and to be able to function. And so they funded our study for our chronic pain use to see if acupuncture would reduce the pain of sickle cell disease. So here is what's called the NIH Pragmatic Trials Collaboratory, which we are also a part of in the study. And here is our logo, the GRACE trial. So this study takes place at 4 sites, as I mentioned, at University of Illinois, Chicago, Duke in North Carolina, University of Florida in Gainesville, and Johns Hopkins in Baltimore, Maryland. All 4 sites have more than 3,100 patients, 95% of whom are Black, who have sickle cell disease. UI Health, Duke Health, University of Florida Health, and Johns Hopkins have a majority of participants who are on Medicare, Medicaid, or are self-pay. So this is what we call a pragmatic trial. A pragmatic trial is a large study. We're indeed going to enroll 366 participants in the study over 5 years. Pragmatic trials test treatments in the real world. Unlike my other 2 studies, the one that I showed you for vulvodynia and angina, those are highly controlled in a lab. This study is out there and we are treating participants who come from the sickle cell clinics, and there are very few eligibility criteria. All comers with sickle cell disease are basically welcomed if they have chronic pain. Pragmatic trials produce results that can be generalized and applied in routine clinical settings. They may test the same intervention as what we call an explanatory trial or a lab trial, like my 2 other studies, using typical patients. They use clinicians who may or may not be researchers, and they measure effectiveness, meaning how well the intervention performs in the real world setting. So we're going to be looking at pain, and we're also going to be looking at another outcome, which is opioid use, anxiety, depression, and constipation. And we're hoping that we can demonstrate that acupuncture reduces the use, not only, of course, of pain, but also reduces the use of opioids. And we'll let you know those study findings. Here are our colleagues, including Dr. Lee here today, who are key investigators at UIC in the GRACE trial. Dr. Bob Maloki is a sickle cell doc at UIC and spearheads a large sickle cell clinic. Oh, pardon me. And so I just wanted to give you, wet your beaks with a little bit about my research. Here is, I thank you for your time. Here is all the creatures of God's kingdom. And there's the koala getting acupuncture, the parakeet, obviously, who has some sinus problems there, the tortoise, the bunny, the elephant, the horse, and the macaw, all enjoying the benefits of acupuncture. And I'd like to share with you now, this is a flyer that we have posted all over town, and we have it on some of the bus lines and the trains. And if you'd like further information, you see the QR code. And we also have a website, which is the gracestudy.uic.edu, or you can just Google Grace Study to learn more about it. I thank you for your time.
Thank you so much, Dr. Judy. Is it possible for you to drop that the flyer for Grace in the chat, and then folks can then print it out for themselves? If you have the
Sure.
Okay, great. All right, yeah. Thank you.
I'll go to the study site to do that. I think that's probably the easiest way.
Okay.
Thank you.
So as the audience can see, acupuncture benefits all breathing beings, right? So many animals have benefited from acupuncture, lots of veterinarians, and of course, we know that acupuncture is very beneficial for adults. And as being one part of this study, we're all very looking very anxiously to the final results. We've gotten very good feedback. We're very pleased about that. So, all right, I'm going to turn it over now to Dr. Lee. And Dr. Lee, I'm going to make you a co-host.
Okay.
Okay, there it is, everyone.
Let me start to share.
Okay, let me make you a co-host. Let's see here. Okay. There you go.
I can share right now.
All right, great. Thank you.
Okay, can everyone see my screen?
Yes, we can.
Great. Thank you, Dr. Basha, for the wonderful introduction, and thank you, Dr. Schaelger. Every time I hear your lecture, I'm very inspiring by your story and the motivation to learn Chinese medicine in China, and your whole encourage and inspiration for doing acupuncture research. So today, I want to focus on how acupuncture can help another population, which is women with breast cancer. So let me start to share a little bit story about myself. I was growing up in China until 18 years old. So after I graduated from high school, I came here. And my mother, I'm the only child in my family. My mother, who was a journalist and computer scientist, unfortunately, she diagnosed with rectal cancer when she was 47. So at that time, I was still in the United States and doing my bachelor degree in nursing. So as the only child in my family, I flew back to China and stayed care of her. So during her last stage of cancer disease, she experienced a lot of the symptoms, like she has pain every day. She feels very tired, and she doesn't want to talk with me because of the symptoms and the pain and the cancer. And she didn't sleep very well because she had hard time with sleep. So I struggled with her for a long time and saw her experience those symptoms. At that time, as a nursing student, I really want to help my mom and in the future to have more cancer patients to relieve their symptoms. So that's why I want to devote myself into cancer symptoms in my future career. So, and then I moved to my PhD program and doing a PhD at the University of Pittsburgh and focus on the breast cancer symptoms. So, as everyone knows, breast cancer is the most common malignancy in women in the United States. In 2022, 287,850 women diagnosed with breast cancer. So, will be 1 in 8 women will be diagnosed with breast cancer in their lifetime. According to a report of American Cancer Society, 75 to 80% of women with breast cancer are postmenopausal, and the median diagnosed age is around 62. So right now, with the development with cancer treatment, the good news is 98% of women will survive if they detect breast cancer early. So therefore, as a nurse, the survivorship and cancer symptom management become important because patients are surviving longer. So usually, women with breast cancer will have their local treatment, which is usually surgery and radiation. After that, they will go through systemic treatment like hormone therapy for 5 to 10 years, chemotherapy, and targeted therapy. So I want to make attention here about endocrine therapy because right now, a minimum of 5 years of aromatase inhibitor, we call it AI therapy, is recommended for postmenopausal women with hormone receptor positive early stage breast cancer. And with the development of the treatment guideline since 2008 and 2018, it encouraged that it can extend it to 10 years after surgery. So people were receiving endocrine therapy, loss can up to 5 to 10 years. Let's take a look of how estrogen plays an important role in women's body. So we know that estrogen will stimulate development of breast and stimulate the mature of the ovarian. Will also help with the uterine, maintain the body temperature, have stimulate the memories. It will have regular the liver's production of cholesterol, and it will have and stimulate the mature of the vagina and preserve the bone density. So what will happen for women with breast cancer when they taking endocrine therapy? So they usually have very low estrogen level. So what you can imagine, if we have no estrogen level, we will have a lot of dysfunction to those systems in our body. So those women who are taking endocrine therapy, they usually experience a lot of side effects, such as joint pain, hot flashes, depression, or mood changes. They also don't have problem with their sleep, mainly due to the hot flashes of light or due to the pain. They feel tired every day, and they're anxious about their symptoms or disease. So there is an urgent need to efficiently manage multiple symptoms during endocrine therapy among this population. So here is acupuncture. So Dr. Schaelger gave a very detailed introduction about what is acupuncture. So I'm not going to repeat again. But what I want to show you a brief video that our group developed together. So
If
that's
you're watching
what.
this video, you're probably thinking about getting acupuncture. What it is, how it works, and how it affects you. Acupuncture is a device which really is constant into the body. It began as a Chinese traditional medicine about 1,000 years ago. It is used around the world to treat various health conditions. Acupuncture works by balancing the body's vital energy, which travels to pathways in nervous and organs. When a young person started using this, she noticed these demands and her body releases natural healing chemicals. Acupuncture can also reduce other symptoms like anxiety, depression, fatigue, and sleep disturbances. In studies with 21,000 patients, acupuncture was shown to reduce chronic pain. We want to learn about the benefits. Now, let's talk about the names. Excuse me, names and outreach. This is a plan used to identify evolution. Acupuncture has 10 times better than that. Close closer to the fitness of human approach. The acupuncturists will insert these in as patients on the back. Most do not experience pain. While this is part of the healing process, the same needs to experience of strong or something transferred. Don't forget, if this is your both with your tongue. This is why it's important to take care of your skin. Sure about receiving acupuncture. Your provider and still in the strength visit.
Okay, does this video answer all your questions about acupuncture?
So Dr. Lee?
Yeah.
Dr. Lee, the audio wasn't good on our end. If it's possible, if you can drop the link in the chat, and then folks can copy it and listen to it, because the audio wasn't good on our end.
Okay. Sure.
All right,
I will
thank you.
drop a link after I finish the presentation, of course.
Thank you.
Yeah.
All right.
So I'll continue. So our group also did a meta-analysis among women with breast cancer. What we found is among 26 clinical randomized clinical trials, acupuncture has been showing efficacy in pain, fatigue, and hot flashes. So right now, JAMA Network published a survey and shows that trends encourage for acupuncture. So we can see that the insurance coverage for acupuncture visit has increased, but the problem right now, most of them are paid out of pocket. So this brings me to think more about the issues right now in acupuncture use among women with breast cancer, because we found that there is a health disparity issue and equal access issue among medically underserved population. Because most of those women currently using acupuncture are middle-aged or middle or upper class with higher education and higher income. And currently, most acupuncture clinics tends to be concentrated in the hyper-income labels. So even though 60% of NCI designated cancer centers have offered integrative medicine and incorporate acupuncture for cancer survivorship care, but still, many people with medical underserved population, they do not have access to acupuncture because they don't have insurance coverage or acupuncture. They cannot pay the cost. They have transportation issues or health literacy issues, and they have difficulty finding an acupuncture practice nearby their neighborhood. So in order to solve this gap in clinic and in research, we developed a study, and it was funded by NCCIH last year to implement acupuncture into federally qualified health centers to alleviate multiple symptoms among women with breast cancer during endocrine therapy. So I'm the principal investigator for this study, and Dr. Judith Schaelger is the co-investigator with other co-Is. This is a 3-year study to focus on to test its feasibility to implement acupuncture intervention into a federal qualified health center for medically underserved breast cancer survivors. We plan to recruit 62 breast cancer survivors and then randomize into 2 groups. So half of them were doing acupuncture, 5-week, 10-session acupuncture protocol at UIC Integrated Health Center. And then half of them will stay their usual care. So we follow up them and at week 5 after the acupuncture intervention, and also week 12 as a follow-up visit. We will conduct some interviews with breast cancer survivors and the staff and providers to give us some insights about what they think are the barriers and facilitators associated with the implementation process. So here are some inclusion and exclusion criteria in order, in case you want to interesting join. So we want to recruit early stage breast cancer survivors who have completed their major cancer treatment, which means they finished their surgery, radiation, and chemotherapy in the past months, and they are currently undertaking endocrine therapy. We only limited to English speaker at this time, but we were broader to Spanish speakers in a later study. So anyone who report pain, fatigue, sleep disturbance, depression, joint hot flashes, or anxiety in the past months, and their average score should be higher than 3. So they should at least experience 3 out of the 6 symptoms, and 2 of them should be physical symptoms like pain, fatigue, or sleep disturbance. So Dr. Schaelger developed this semi-standard acupuncture point protocol. The beauty of this protocol is it can help us not only relieve one symptom, it can help relieve multiple symptoms such as pain, hot flashes, fatigue, sleep problems, and depression, anxiety at the same time. So our long-term goal after this study is to facilitate the widespread implementation, dissemination, and utilize of acupuncture for symptom management in federal qualified health centers nationwide. And finally, we want this study result to promote the public and private insurance coverage for acupuncture. So this is another thing we are doing to help with Medicaid in acupuncture coverage for Medicaid coverage in Illinois. So Dr. Schaelger and I are consultants for the state Medicaid programs. So right now we have included chronic pain and beach presentation to cover by acupuncture in state of Illinois. So we are still working on them to hopefully after we finish the study, Illinois Medicaid program will cover acupuncture for joint pain and multiple symptoms in Illinois. So I have another study going on in order to understand what's happening and what are the mechanisms underlying acupuncture. So very luckily, we got funded from National Cancer Institute for a multi-omic study to examine the effects and the mechanism of acupuncture on psychological symptoms among women with breast cancer. So let's give me some background and show you what do you think about the mechanisms of acupuncture? So Dr. Schaelger gave us a presentation about the holism of acupuncture. So most of the so acupuncture, the mechanism of acupuncture is still a puzzle for many years. So previous technology had the limitation to understand the complex mechanisms, and most studies evaluate the changes molecules focus on one pathway. So most basic studies right now focus on the linear correlation between intervention and effects, but ignore the comprehensive network that is influenced by acupuncture. So based on the theory of holism, acupuncture can treat multiple symptoms together, and each tissues of the body are connected together, communicate through each other and influence each other. So what I want to understand is like how acupuncture influenced pain, fatigue, and sleep. What's happening in their body? So what we plan to collect some stool sample to evaluate the gut microbiome. And also we want to use the new technology on targeted metabolomics to understand the small molecules to give a holistic understanding of all the molecules in the body and what's going on before and after acupuncture. So we conduct a feasibility together and published the results. What we found that first, it's feasible to conduct acupuncture in women with breast cancer to relieve psychological symptoms. And the other thing we found that it gives some signal about glutathione pathway. Glutathione is one of the antioxidant pathway that can influenced by acupuncture. So for this study, we want to the main purpose of this study is to understand the effect of mechanisms of acupuncture in treating pain, fatigue, sleep disturbance among women with breast cancer through multi-omics. So we are going to perform an integrated analysis of serum and fecal metabolome and the microbiome among breast cancer survivors before and after the intervention. So we plan to recruit 44 breast cancer survivors. They are still doing the 5-week 10-session acupuncture protocol at the USC College of Nursing and Integrative Health Clinic. We will collect the blood sample and stool sample at baseline after the acupuncture intervention and the follow-up session at week 12. So the good news that we are still recruiting, and we need the help to help disseminate the flyers. So this is a very nice picture of our team. Dr. Bashar is on the right side. She helps a lot with our breast cancer survivors, and our patients do love her. Except that we have our co-eyes in this study, Dr. Judith Schaelger and me, and also we have Dr. Moore. She's another acupuncturist and who is involved in these 2 acupuncture studies right now. So I want to thank you for my amazing team, because without your help, we cannot move so fast. We're still recruiting right now. So if you know anyone who has breast cancer, who experienced those symptoms, please contact us. Contact our research coordinator, Natalie Leaf, and here is her contact information. And if you have any question about acupuncture, or if you experience any symptoms during your breast cancer treatment, please contact me at hongjin@usc.edu. Thank you very much.
Excellent. Thank you so much, Dr. Lee. That was a great presentation. And I'm really hoping that our audience, really have a better understanding as to how acupuncture can impact various components of the human body, including the gut microbiome. And so thank you so very much for that. So I'd like to take questions from our audience. So that we can, this is your opportunity to do that deep dive into acupuncture, and holistic care for sickle cell in particular, because we know that that is a highly underserved population, as well as breast cancer. And we know so many patients have been impacted by breast cancer in the underserved community. So, do I have any questions? Yes, I'm live, so
Yes.
I do have a question here.
Can you hear me?
Yes. Oh, yes, Dr. Ramadan. Thank you very much.
Okay. Assalamu alaikum. I just want to say that I am so happy to see this kind of research going on. I became familiar with acupuncture way back in the early 70s with Nixon discovering it over in China. And we, at that time and studying in medical school, thought this was almost magic. We had no basis to see how this could work. It didn't fit in any paradigm that we were studying. And but after I looked at it, I said, wow, the potential for this. It was incredible. And I was just treating sickle cell for years with narcotics and so many chronic conditions, just treating with NSAIDs and narcotics and anything else that came up. But no one was doing this basic research to merge this into the way that we treated. And this is the kind of research that talks to doctors. And this is the kind of research that brings about change. And to think that you're using it for considering it in chest pain syndromes and sickle cell and vaginal pain, vulvodynia. This is the start, and I'm just excited and to give some explanation too. And you're taking it beyond just this is something this is a problem and this does work, but why in between, explaining that in terms that practitioners can understand. I think this is novel, and I just encourage you to continue doing this great work. That's all I had to say. Thank you.
Thank you, Dr. Ramadan. The UIC team is amazing, and I'm just excited to be a part of it. But they are the drivers. They are the ones who developed the protocol, and they're the ones who really were the engine behind bringing this to the forefront and getting the NIH funding.
Yeah, if I may, alaikum salam to you, Dr. Ramadan, and thank you. You hit the nail on the head repeatedly. So there are so many things that came together at one time in the United States. The Black Lives Matter movement, the commitment from NIH, may I proudly say, to health equities research, research in which focuses on research in medically underserved populations, including Black people who are at the lower end of the economic spectrum. And it's about time. And acupuncture, so may I just say that NIH is committed to health equity research. And there are several institutes that are very, very interested in, there's 36 institutes that comprise NIH, and several of them are very, very interested in acupuncture research for multiple reasons. One being that acupuncture, the American public has been, saying that acupuncture works, and it's a very strong alternative therapy. And physicians understanding that they wanted to treat their patients, and make them all better, but yet they understand that Western medicine has limits. And then for our dear friends who suffer from the ravages of sickle cell disease, Dr. Ramadan, as you're well aware of, that there's a syndrome called opioid hyperalgesia, that really people who take opioids chronically, such as morphine and methadone and other opioids, can actually end up with something called opioid hyperalgesia, where there's a rebound pain that is more painful than if the participants were not on opioids. And this is intolerable. And so all these things have come together in American society. And I think Dr. Lee's research is really illustrative of that the NIH is supporting research. Dr. Lee is funded. I'm funded by 4 institutes. Dr. Lee is funded by 2 or 3 institutes. And they are interested in what we call mechanisms of acupuncture, meaning why does acupuncture work? Because then if we can know how acupuncture works, then Western medicine can also take some of these biochemical pathways and neurological pathways and study them more in order to create even more therapies for the 50 million Americans who suffer from chronic pain. And so this
Absolutely.
is
What's a meridian? You know, that's what doctors are saying. What is a meridian? Where does it fit? You know, I can't cut it out. I can't see it. And those are the sorts of things, you know, but we're showing all of the time it works. What we're saying works. And it was just for me, when it worked on animals, that was it. You know, in my own understanding and following the trend of the acceptance of it, that was so important. And this work that you're doing is just timely, and it's at a turning point in medicine when you know, we've been going down one road for so long, and the benefits from that road are like running out. And we need something new, and I think this represents it.
Excellent.
Thank you.
Amazing. Wonderful. You're welcome. Any other questions? We have a live question here because we are live today at the mosque. And do I have questions here? Okay, yes, we have.
Dr. Lee said they were still looking for participants in the study. Would that be people who are currently undergoing treatment for breast cancer, or people who have completed treatment? Like, who was she looking for?
Okay, Dr. Lee, did you hear the question?
Yeah, I hear part of the question.
Well, the question was, in terms of recruitment, are you accepting patients who have completed their treatment, or if they're still undergoing treatment?
Okay, yeah, good question. So we currently recruiting patients who finish their major cancer treatment, which means they finish their surgery, chemotherapy, and radiation therapy. But those patients should be on endocrine therapy. So yes and yes. So we need patients who are
endocrine therapy.
Endocrine therapy.
What is that?
Our endocrine therapy is who is taking either aromatase, the pills. They usually take them pills to 5 to 10 years after radiation and chemotherapy. Either tamoxifen or natural, and those women should be familiar with the drugs.
So the short answer is that once they're completed their major treatments, their chemo as well as surgery, but while they're on the aromatase inhibitors, they can still participate in the study.
Yes. If they are not sure about the criteria, please give us a call. We can do the screening first to see whether that person is qualified to participate.
Wonderful, wonderful. Any other questions? I'm going to check the chat. Yes, Brother Bashir, yes.
Yes, thank both of our doctors for coming on and providing us this important information. I know the title of the subject matter was underserved communities. If someone was seeking to have acupuncture, how readily is it available to them? Let me ask too, in China, what are the most common uses of acupuncture in that society? And one other question, two, in medicine, I think they look at the results, whether it's the Western medicine, the Chinese medicine. What are the best outcomes? We're trying to improve the health of society. How does China society, health-wise, and American society with our medical system, how do they compare? Thank you.
Okay, those are loaded questions, Brother Bashir. So, Dr. Lee or Dr. Schaelger, jump in.
Dr. Lee, you want to take a try, and then these are great questions. Please.
I think I'm muted. Yeah, those are great questions. I think in the United States, the most use for acupuncture is for chronic pain right now. It's both showed in the meta-analysis in the research. There's a big analysis in 2018 that published by Dr. Wickers. He conducted this research, I think I'm pulling out the result right now, among 20,827 patients from 39 randomized control trials. So from this result, it shows that acupuncture do have very strong evidence to reduce chronic pain. So this is from the clinical evidence, the academia side. So from the clinical side and policy side, right now in the United States, Medicaid and Medicare do cover chronic pain. So Medicare covers chronic pain, but not all the states for Medicaid. So this is current status about how acupuncture covers different symptoms in the United States. So of course, it can help with other symptoms such as like fatigue or hot flashes in breast cancer, and also other symptoms in other population. But to keep it short answer, chronic pain is the most common condition that covered by right now the United healthcare system. And in China, there are more, I think, conditions that why people goes to use acupuncture in China. So because it's very basic in traditional Chinese medicine, and it's cheaper and more accessible than acupuncture that can be accessed in the United States. So the price doing acupuncture in China is almost about 30% that's conducted here. That's what I feel in the Chinese system. So Dr. Schaelger, please see anything that I'm not covered. Yeah.
Yeah, the cost in China can be as low as $1 per treatment, because it's subsidized by the Chinese healthcare is subsidized by the Chinese government. And the usage is different, and that's where my work comes in. The treating sickle cell disease with acupuncture was on my bucket list, and as well as angina. Angina is ischemic pain, or pain from lack of oxygen. So it's different than musculoskeletal pain or neuropathic nociceptive pain, to get a bit more technical. And so because of that, these are not only necessary to expose the American public to all aspects of acupuncture use for all aspects of diseases, because in China, acupuncture is used for pretty much everything. But in the United States, it's known pretty much for pain. And so even Dr. Lee's work, when we're talking about anxiety, depression, fatigue, this is really quite a breakthrough. So it is our hope. But also the NIH's plan to help us promote acupuncture moving into the American healthcare system. So as a clinician, you get the satisfaction and you're given the opportunity to treat patients one at a time, and to make the world better, one patient at a time. And in research, your research could be so impactful that it could shift the American society. In the sickle cell trial, in the GRACE trial, being part of the Pragmatic Trials Collaboratory of NIH and the HEAL Initiative, NIH and the HEAL Initiative, which is part of NIH, have a commitment to integrating these studies into the fabric of the American healthcare setting. And this is what we're hoping, if we get a positive outcome, that indeed it will. The purpose of pragmatic research is to influence policy. Right now, actually, Dr. Lee had mentioned for Medicare, the only disease condition that acupuncture treats is lower back pain. The only condition that's reimbursed by Medicare is lower back pain federally. And then in terms of this, in Illinois, as Dr. Lee had mentioned, she and I are on a task force with the Illinois Health and Human Services, Illinois Department of Health and Human Services. But acupuncture will only be reimbursed currently for lower back pain and turning of breech babies. And so not what we wanted, but it's a good start. And so Dr. Lee and I have just submitted for publication a paper reviewing the barriers for lower income people using acupuncture. And of course, you can think of them right off the bat. You don't have to be a scientist. You know that in many lower income neighborhoods, there's no acupuncturists. Acupuncturists are setting up shops in upper income neighborhoods. And because of that, there's a tremendous health equity issue. And Dr. Lee and I have been rattling NIH's cage and rattling the American public's mind to say, hey, look, all patients deserve acupuncture. And this is very much a health equity issue. And so NIH has been a big advocate for our work. And slowly, as now acupuncture is covered in some form in 14 states in the United States for Medicaid, for public aid reimbursement. But slowly, the dominoes are falling, and more states will start reimbursing. And it will take a while, but we've really had no opposition to this, and it needs to happen. So I think, did we answer everything?
I think so. I think that you all have done a great job. First of all, I want to say really that Dr. Schaelger, you and Dr. Lee, that this work is very personal to you both, and is very personal to me as well. And I think that what I often tell patients is that acupuncture can treat everything. It doesn't cure everything, but it can treat everything, because we're always looking to mitigate symptoms, and whether it's pain, whether it's fatigue, nausea, headaches, acupuncture can address all of that with great success.
Yes, and may I also add that there's a nice equilibrium that's being established with NIH at the forefront, which is Western medicine, acknowledging that Western medicine, of course, is a powerful tool, but doesn't cover everything. And so NIH supports the term integrative medicine. So we integrate Western medicine with complementary and integrative health treatments. And if we do that, then the patient is sure to benefit.
And that is holism. Yes. Are there any other questions before we wrap up?
One other question.
Anyone from yes.
When we talk about holism, and there's an issue with men today in this society, erectile dysfunction. Is there any practical use for acupuncture in that area? You talked about blood flow. I know the Dr. Schaelger, she mentioned blood flow. Is there any correlation with that situation?
Absolutely. That is it's a common problem, and yet problems as well. Because I'm a midwife, I focus on vulvodynia, which is a problem in women, but in men, it's absolutely, in terms acupuncture as well as Chinese herbs, for treating erectile dysfunction. Dr. Bashir and I have treated much of that for treating, impotence, premature ejaculation. Absolutely. A lot of these disorders have a component of what's called an essence, low essence. And so we try to treat or strengthen the essence in men. And so not only do they get better sexual function, but they also get better health in general, as opposed to the problem with Viagra. As you know, if a man's cardiovascular system is not strong, then it can be very dangerous to take Viagra. And so we try to strengthen the whole system, the cardiovascular system, and as the body strengthens, and then we have a concept Dr. Lee is very familiar with, of branch and root treatments, meaning you treat the branch, which in this case is erectile dysfunction, but we also treat the underlying energetic imbalance, which is the root problem. And so we strengthen the essence, we move the blood and the chi, and then when we do that, the patient gets stronger. And all patients who get acupuncture, you treat one condition and then they come back to you a week or two later and they say, you know what, I'm sleeping better. And my constipation is gone. And my depression is better. And my anxiety is better. And it's because acupuncture, because of this theory of holism that we keep talking about, everything is affected positively. Or they say, my eyesight's better. Because when you treat one organ system, all of the organ systems are positively affected. So Western medicine calls this adaptogenic. And so acupuncture is a therapy that is very adaptogenic. It strengthens the whole body.
Yeah, great answer. Dr. Lee, is there anything you'd like to contribute to that?
I think last year, I'm just curious about this question. So I did some search online. There are some trials that show efficacy in the ED problem among male. So if you're interested in, I can send you some research results. I think they conduct a meta-analysis to combine different trials to show the result. So I'm happy to share. Yeah.
Wonderful, wonderful. We know the importance of reproductive health. Traditionally, people see reproductive health as just a woman's issue, but it is a man's issue as well. So thank you for that question, Brother Bashir. Any other questions before we wrap up? Okay, well, thank you all so very much. Dr. Lee, Dr. Schaelger, you really, I think, provided some very enlightening information for our audience. We appreciate it, and I thank you so very much. For those of you who want more information, please look in the chat. There is a link for the GRACE study, and that's with Dr. Schaelger, and with Dr. Lee, it's the breast cancer study. Her information is in the chat as well. So if you have friends, family, people in your lives who are dealing with breast cancer issues, in particular, the symptoms related to treatment, right? In addition to the sickle cell, which is such a severely underrepresented community. And so please, please, please share the information. So I thank you all. We will close our Taleem. Again, I thank Dr. Lee and Dr. Schaelger for participating. And if there are no further questions, we will end in prayer. And I thank you. With God's name, the merciful benefactor, the merciful redeemer, we pray that you grant blessings upon those hearing this message today. And we pray that you cover and protect us all from danger, from illness, from catastrophe. In your name, God. Amen. Thank you all. Thank you all. Thank you all.